Okay, wonderful. Thank you so much. Like Felice mentioned, this presentation is about an experience that we had within the past year, which is an early engagement of community research partners into a project, which was tailoring an IRB-approved research ethics training. And we were orienting this to make sure that we were having effective knowledge translation. And I would like to introduce my co-presenters as well. So if you could all turn your video and audio on. I'll start with myself and a visual description. So my name is Chris Stanley. I'm a project director at the Research and Training Center for Disability in Rural Communities at the University of Montana. And I am a middle-aged white woman with long blondish hair that I'm wearing in a braid. And I'll pass it over to you, Will, to introduce yourself. And then if you could just pass it on and each person in turn, that would be great.
Awesome. Thank you, Chris. Yeah, my name is Will Horde. I am also a part of the Research and Training Center on Disability in Rural Communities at the University of Montana. I am one of our knowledge translation coordinators. I am a white man in my late 20s with medium length curly hair that's pulled back in a bun. I have a mustache, a nose ring, and I'm wearing a black wool shirt. And I will pass it off to Christina.
Good afternoon, everybody. I am Christina Gunter. I am with Walton Options for Independent Living in Augusta, Georgia. I am a middle-aged white woman with short, brownish, grayish hair. I've got silver earrings on today with a blue shirt with cheetah print on my shoulders. And I'm looking forward to today, and I'm going to pass it to Lisa.
All right. Hi, everyone. I am Lisa Sistar Harkins, and I am also at Walton Options for Independent Living in Augusta, Georgia. I am an older white woman with short gray hair or silver, depending on which way you want to look at it. And I am wearing a top that is pink and black and white kind of pattern. And I guess from there, I will go to Cora.
Hi, can you see and hear me?
Yes.
Okay, wonderful. I am Cora Crecilius. I work for Wyoming Independent Living here in Sheridan, Wyoming. I'm an independent living specialist. I'm a middle-aged white woman with light brown hair, and I'm wearing a blue plaid shirt. I'm really pleased to be here. Thank you.
Wonderful. And to just provide a presentation overview of what we'll be covering in the next 50 minutes or so, we're going to talk about the importance of community engagement in research and why it matters. We'll also be talking about a challenge that we faced and how we handled it that involved traditional institutional review board or IRB trainings versus community partners' needs. And our solution to that challenge, which was adapting a training titled Research Ethics for All for Center for Independent Living staff. We're also going to talk about the outcomes of that adaptation and the insights that we gleaned from the process. So we'll be discussing how this approach strengthened trust, capacity, and communication. And then at the end, we'll have time for discussion and Q&A, where we'll talk about lessons learned and future directions as well. And with that, I'm going to pass it off to Will for the next couple of slides.
Awesome. Thank you, Chris. So in our research project, and Chris will talk about it a bit more in the next few slides, but we've been utilizing something called community-based participatory research. And what that is an engagement of the stakeholders in the research as equal partners throughout the research process. So in our case, it was RTC Rural and Center for Independent Living staff that we were working with. And the impact of CBPR, if done correctly, can be huge. One of them being empowering disenfranchised communities to have a voice in the research that they're a part of. Another one being building trust and enhancing communication between research participants and researchers. But maybe the most important one of them all is countering historical harm and exploitative practices in research. Unfortunately, we could do an entire presentation on exploitation in research practices, But to briefly just illustrate the point, I wanted to bring up one of the maybe more egregious examples that has happened in the past that you may have heard of. That one being the Tuskegee syphilis study in Tuskegee, Alabama. In this study, which occurred from 1932 to 1972, researchers knowingly withheld effective treatment from hundreds of Black men with syphilis. This was done without their knowledge or their consent to track syphilis's progression in the body. And it led to about 100 men dying from syphilis or the complications of syphilis, and about 300 more being harmed. So just to say, this study fundamentally violated the ethical principles of research, and rightfully so, has created a legacy of deep mistrust in research for some marginalized communities. So in our work to prevent this, we use community-based participatory research, especially in our research. With the disability community, we think about it as nothing about us without us. So research should be with disabled people and not just about them. And we can pass it off to the next slide.
Thanks, Will. And so another part that I don't know if everyone is familiar with is what Centers for Independent Living do, that I thought maybe we should just define real quick here. So Centers for Independent Living are nonprofit, non-residential service and advocacy organizations that provide services for folks with disabilities across the country. There's a Center for Independent Living in every state and territory of the US. And Centers for Independent Living are also federally mandated to be staffed at least 50% by people with disabilities of any types. Lisa, Christina, Cora, is there anything you would want to add to that definition?
I would just say that it's we're also are required to have at least 51% of our board have to self-identify as persons with disabilities. So, and we do any age from birth to the 100 or whatever. So there's no limit in any kind of disability. So whether it's mental, physical, cognitive, any kind. So sometimes there's a common misconception that we only deal with people with physical disabilities.
Awesome. Thanks, Lisa. And I'm seeing a question in the comments that somebody's asking if you also serve the needs of family members of people with disabilities.
Yes, we do.
Great. Thanks for adding all of that. So I wanted to provide some background and context for our adaptation of this research ethics training. And the context is that we were in our first implementation year of rolling out a study called Rural Health Pathways.
Sorry.
And Rural Health Pathways is a 5-year study comparing 2 different remotely delivered models of a health promotion curriculum, which was tailored to the experience of disability. And the name of that health promotion curriculum is Living Well in the Community. And just to give you a snapshot of that, it's a 10-week curriculum where folks with disabilities begin by identifying a personally meaningful quality of life goal that they want to work on. And then over the course of the next 9 weeks, they are exposed to some health promotion content that they might want to adopt to take small steps to improve their health as they work to their quality of life goal. And so we worked with, collaborated with Centers for Independent Living from across the US to recruit participants for this study, to deliver the intervention, and to support the data collection efforts. And so this past year, 2024 to 2025, was our first intervention delivery year. And move to the next slide. So as we were getting ready to roll this out, as we were in the midst of training the SIL staff who are community partners on this project, are in the process of doing that, we needed to get approval from our university's institutional review board, that is the organization that manages the human subjects ethics to make sure everything that we're doing is rolled out in an ethical way. And they mandated that we provide a human subjects ethics training to our community partners who were delivering the intervention. And this was something that was new to us, to have this mandate to have to train our community partners to do this. And it seemed like a bit of a hassle because The traditional trainings, so for example, the city training, if any of you have done that, is very time intensive. When I take it, it takes me 12 hours to get through it. The content is really dense. It's also overly broad and it's not really tailored to the role that the community partners would be doing. So it's more than what they would need for their role. And it's not super accessible. The language is complex and it is really lacking disability perspectives. So a turning point that we found was when our institutional review board manager suggested this training called Research Ethics for All. That was a training that was created recently with people with intellectual and developmental disabilities, and suggested that we might use this training or modify it in a way that would be better suited for the needs of the folks that we were training from the Centers for Independent Living. And I'm going to pass it back to Will to share more about what that training involved.
Yeah, so Research Ethics for All, it was developed by Dr. Ariel Schwartz out of the University of New Hampshire and Dr. Katie McDonald out of Syracuse University. And like Chris kind of briefly mentioned, it provides community research partners a disability accessible education in ethical issues in social and behavioral research. And not only was it made with people with developmental disabilities, but it was also made with disability service providers, researchers, and IRB administrators and members. And we can move to the next slide. Perfect. So Research Ethics for All in its current format is an online a free online training that you can access. You just have to create a login. And it has, I believe, 5 units that you can just work through on your own. But the great thing about Research Ethics for All and the creators of Research Ethics for All is they recognize that there's this huge gap in ethics training for community partners. So they want it to be adaptable and they want it to be accessible. And they actually prefer that it's used in a group format. And so that's exactly what we did. We took the training materials and we turned them into a 90-minute online session, Zoom session with our community research partners, keeping the core principles of the research intact. But we also wanted to focus on things that would be specific to the Center for Independent Living staff that we'd be working with. So their experiences and their roles. We wanted to include realistic scenarios. A few that came up were confidentiality in virtual sessions and guardian consent. So if a consumer consented, but maybe their guardian didn't, that was a huge thing we talked about. And then we also wanted to emphasize longitudinal research goals. So the surveys that we were providing, the pre, post, and follow-up, and explaining why those surveys were important to the research and why we were asking the participants to fill them out. And then at the end of it, after we did all of that training, we did a one-on-one certification with each of the community research partners using the materials that were provided by Research Ethics for All. And the great thing about this is once you are certified in that test, you have the certification for a number of years. You can also retake the test. Like I said, they really want this to be accessible. There is a certain percentage that you have to pass, but it's really easy to go back and talk to the person about it and kind of work through to make sure that they are understanding the material correctly. Because the goal of all of this was to empower the SIL staff to be able to explain the research clearly to consumers that were participating in the study.
And I just want to add that as part of last year's implementation and to measure the success of our knowledge translation efforts on this training, we invited all the participating SIL staff members, Center for Independent Living staff members, to complete an anonymous survey asking about their experiences with the Research Ethics for All training. So we asked a few questions. We asked, after taking the Research Ethics for All training, how did you feel about your capacity to talk with participants about the study, both during the recruitment phase and throughout the project rollout? We also asked what was something that you appreciated about the Research Ethics for All training, and what is something that we could do to improve the Research Ethics for All training to better tailor it for training Center for Independent Living staff in the future. And the feedback we received was positive in general. For example, one respondent shared that they felt much better prepared to offer explanations about the overall purpose and intent of the study. And another person shared, they said, I felt very comfortable with being able to explain the reasoning behind the research project and why it's important for the steps being taken. So for the next part of our presentation, we'd like to invite our community partners to share from their experiences with this training. And one caveat I'd like to make is that this research ethics training was embedded within a 10-week training in which we held live training sessions twice a week for 2 hours per session. And I know that folks receiving this training, for those folks, many of the components can run together a bit. So just for those of you in the audience, as you're hearing folks talking, just to keep in mind that this research ethics training was in that broader context. So the first question that I have for you all, and feel free to answer in whatever order you like, is thinking back to the very beginning of the research project. Can you tell us about a specific moment or an interaction where you felt that your early engagement as a co-researcher made a real difference? And that could be a moment that built trust or improved how we communicated, or where you felt that your capacity grew.
I guess I'll go first on this one. I guess for me, the biggest thing was, as the research team, besides the Living Well team, made us feel a part of the program from the get-go. They presented everything to us, and they really made sure that we felt the value of everything, the trainings, the information, the research behind it. Like, they made us feel 100% a part of it. From the get-go, and having the ethics training part of that, it just kind of really helped with that buy-in of the project to help us, give us the boost that we needed to make it work right.
Awesome.
I guess,
thank you for sharing.
I guess I'll tag team off Christina there, since we're in the same office together. I would say everything she said, I agree with too. And I just felt like I felt like there was a lot of good communication. Y'all kind of kept us involved in what was going on with the research, and I think the training that we got, I know for me personally, helped me better communicate to the participants, or the ones that we're trying to recruit for participation, to explain to them about the research, how everything would be confidential and all. So for me, I think the communication was a big part of it. So I feel like we wouldn't have benefited as much with less communication.
Awesome. Thanks for sharing about that, both of you.
I go next.
Yes, please, Cora. Thanks.
Thank you. I absolutely agree with everything that has been said. And just speaking personally, it helped my confidence so much to feel part of a research team that included and respected and involved the participants. Instead of coming in as a health coach, like, hey, I'm going to help you be more like me, healthier, better, smarter. To say that we are all working together to develop better ways to help people who identify as having disabilities in rural areas. It really helped my buy-in, which translated pretty quickly and directly to my participants' buy-in. And the communication both ways was so empowering.
Awesome. Thank you for sharing about those experiences. I'm going to move us to the next question, which is, in what way did the Research Ethics for All training change your confidence? And Cora, you just spoke to this a little bit, so you don't need to double up. But in what way did the Research Ethics for All training change your confidence or your ability to talk about the research? So if you have a short story or a conversation where you felt prepared because of the skills you developed, we'd love to hear about that.
Lisa, you want to go first this time, or do you want me to go first again?
Let me see. I do feel like I was better prepared. I knew a little bit of the history about how persons with disabilities were treated in past research studies, like Will alluded to. So, and I know traditionally over time, persons with disabilities have kind of been left out of the conversations and research and stuff like that, so they didn't have a voice. So I felt more confident that we were able to include, that y'all were including persons with disabilities and gave us a better way to kind of explain things to them about what the research was, how we were going to protect them, keep their information confidential and stuff like that.
Yeah, I definitely agree with all of that. And on top of that, it's just kind of, I mean, all of us have done some type of research at some point, but like the step-by-step process that the ethics kind of gave us, it definitely, for lack of a better way of saying it, it armed us to be able to go and explain what the project was, what the purpose was, how best to relate the information to the people we work with day in and day out, and give them the information, because we were able to understand it. Because without the ethics class, and it was just put in a way that just made it simple and informational, and it made it easier to relay that to the people we're working with.
Chris, I did want to add one thing. I know one of the things that came up during that training, and we kind of all had discussions on it, was when you have someone who doesn't want to be part of the study, but they're, I guess their caregiver or their guardian wants them to be. So to me, the training helped me learn ways to identify, maybe by body language, that kind of stuff, if someone is not really wanting to do that. So, and it's their choice. So it's not the guardian's choice, it's their choice. So, and that's a big part of our Center for Independent Living philosophy, is it's their choice. Everything should be about that person's personal choice. So that for me kind of, was beneficial to learn what to look for if someone's not really wanting to participate, because you don't want someone participating that doesn't want to do it or feels like they're being forced to do it.
Yeah, absolutely. I appreciate you speaking to that, because that's a conflict when you're getting different messages and you need to know whose message to attend to, right?
Yeah.
And I know part of the training that Will adapted, using the original components of the training from Research Ethics for All was like a little activity. I guess this was the certification exam, where you were identifying, like looking at the body language of some images and like, does this person look like they're consenting or not? So just understanding that it's not just what you're hearing verbally, but like to pick up on other cues that you're getting from people.
And that kind of does go along with a lot of stuff we deal with here personally in Center for Independent Living. We'll have someone come in and say, I want my grown adult child to do this, this, and this, but the grown adult child isn't saying that's what they want to do. That's what the parents wanting them to do. So I think Christina, I know for sure, can speak to this. We come up with that a lot. So we've got to kind of navigate that thin line and see what the consumer wants. And that's not always an easy conversation to have with the adult caregiver or guardian or whatever. That's not always an easy conversation to have with them.
Yeah, absolutely. And I also appreciate, Lisa, that you were mentioning the independent living philosophy and how this training seemed to be a good match with independent living philosophy, where it's like putting how would you describe independent living philosophy?
Cora, I'm gonna let Cora speak. I feel like I've been doing more talking.
I would say it all comes back to nothing about us without us. It's very consumer driven. And we have parameters and goals and paperwork and things, but everything is around what the person wants. And so listening skills are such a huge part of what we do. And this training enhanced that on so many levels. And then the emphasis on consent was also hugely beneficial to tailor and to enhance our mission and our values. It paired very well.
I was going to say the same thing. Some of the aspects of the ethics training it just matched up so much to our sales stuff. And I feel like it made me a better independent living advocate for our consumers. because of having that ethics training. Like, I'm able, even though some of it I knew already, but at the same time, it made it a little more understandable and relatable. And it definitely, I feel like it has definitely helped provide me a better stepping stone, foundation stone as an independent living advocate in my job.
Well, Chris, I could throw another one in there. That's a big thing with Centers for Independent Living, and what we learned in the research ethics training was the part about confidentiality and mandated reporting. That is a big part of what we do. Everything is confidential, we go above and beyond to make sure information is not shared, and then mandated reporting, that's kind of a thin line. You got to know exactly when you want to put your toe over that line. So we're all mandated reporters as well. So that kind of went along also with the training. So.
Yeah, you all are bringing up such good points. And I know one of the questions we asked was what was something that we could do better in the research ethics training, and the responses were anonymous, so I don't know who shared this, but somebody had shared that confidentiality, like their Center for Independent Living had a pretty strictly defined way of viewing confidentiality, and some feedback they gave us was that it might be good and helpful for them to have better alignment with their centers take on confidentiality and the research project's take on confidentiality, just to make sure that it felt comfortable for everyone. So that's like a piece that we're going to continue to learn and grow with as we continue to roll this project out and use this training for future projects as well. Yeah. Thank you all for sharing all about that. The next question is looking back at, oops, too many slides forward. Sorry about that. So the next question is, looking back on your experience with research ethics for all, what stands out as the most memorable or significant story for you? Which could be a story of a challenge, a success, a moment of connection, or something that surprised you. And I would just share that for me, what stood out was having been part of these intervention projects before and working with Centers for Independent Living as community partners, but not being mandated by our institutional review board to do a research ethics training. The difference was like night and day in the buy-in you all had and the understanding that you all had of like why we were doing these research procedures, like why are we doing these surveys at the beginning and after, and then like a couple of months after. And it seemed to me like, and the feedback that I heard from folks was that it was clear. It was clear enough for you all, like why you were doing that and why it was important. It wasn't just this like box you had to check because you were participating and your SIL was like getting some money for participating, Yeah, so I'm curious for you all, what was a most memorable or significant story from your experience with this project?
Could I start?
Yes,
Yeah.
thanks, Kafai.
Thank you. I had one participant in particular who was autistic, and she really did not resonate with the self-improvement model. And we will help you pick a goal and manifest it and grow and be a better person. She was like, eh. But I kept repeating the things from the training about confidentiality and about the importance of responding to the surveys and things. And it wasn't until the meeting about mental health that she really bought in and seemed to have more to say. And she was so much more direct and engaged. And she spoke to a perceived bias in the training and potential hesitation with other people who identified as being disabled. The presentation of either you're mentally healthy or you're mentally unhealthy, and it just opened the floodgates for her to speak in order to benefit other people. And from that session forward, she was so much more willing to share her own experiences and to feed the conversation with stories from the past and things. And it just seemed to click for her that I wasn't interviewing her to learn what was right and wrong about her. She was a partner, how to tailor this information to better help people. And so that was a very powerful meeting with her. And I felt very good that I felt like she was getting and trusting what I had been saying all along. It was like she was in. And so it was very satisfying.
Yeah, as Corey, I think if I'm understanding what you're saying, I think you're getting at like the research ethics for all and the like confidentiality part of the training, like provided you with a foundation that like kind of like several steps down the road came across in your interactions with this participant in a way that was helpful. Is that accurate?
Yeah. Yes, I guess what I'm trying to say is I was kind of nervous working with her because she wasn't very engaged. She wasn't seeming to buy in. She was uh-huh, uh-huh. And so I just kept repeating, everything is confidential and we respect. I kept coming back to lines that I had learned in the training, and it seemed like that sunk in and she understood the purpose of the meetings and that we trusted her and that she had the willingness to consent or not.
Mm-hmm.
And so that I felt that it was that foundation that she trusted that allowed us to move forward a lot better.
Mm-hmm.
And so I'm really glad I had those foundational things to keep coming back to when I had felt awkward in earlier meetings. I went back to the real training and just kept repeating things, and they broke through, I felt.
That's great. Thanks for sharing about that.
I wanted to kind of add something, and Christina may or may not have something else to add to it, but I feel like when we were teaching our Living Well in the Community class, we told them from the very beginning, everything is confidential. You know, we made sure they all understood that. They could talk if they didn't feel comfortable talking, they didn't have to talk, but it was very much a peer-centered training. And so for me personally, I wanted to make sure that they all knew they didn't have to share if they didn't want to. And then we did tell them a couple times, everything stays in this room, you know, nothing leaves here, you know, and I feel like a lot of them opened up once they really bought in that, okay, so what I share here is not going to go any further. And I feel like we were well equipped to explain to them the process and how confidentiality was important and what they had to say was important. And I felt like I think we got helped. I think we got some help with that through that ethics for all training. So Christina, did you want to add anything to that or?
Yeah, and mine's slightly a little different. The other thing is for the training itself, I really appreciated the team's understanding. Like they made it personal to me. And when we actually took the test, it's like they really understood me and they valued my information and my opinion and what worked for me as a person, not just as a participant in the training. So I feel like they embodied the ethics training itself, just even in participating and training us. And I just feel like they were able to just take into those accounts, and by them practicing what they're preaching, literally, I was able to do the same. And like I said before, it just kind of really has I feel like it has definitely made me a better advocate for our community and for the disability community.
Well, I will say one thing too for me, Chris, was it's been many, many, many years since I was in college and and did any kind of sociology or research class. I had forgotten all about the Belmont principles, and that was something that was really kind of, you know, talked about. I felt like in good detail, explaining about it. So I had forgotten about that. Because like I said, it's been many, many years for me. So I appreciate that clicked something in my head, and I remembered about that, about the 3 core ethical principles and all. So and I don't know if you want to run through what those are real quick. So people that maybe there's other people that don't know what Belmont principles are.
Yeah, thanks for bringing those up, Lisa, and thank you all for speaking to this. Will, do you have those handy?
Yeah, I just pulled them up. So
Awesome.
the 3 main principles of the Belmont principles are respect for persons, beneficence, and justice. Which there's more to all of those, but that's kind of just the quick overview of the 3 principles.
Yeah. Thanks, Will, and thanks for bringing that up, Christina. It's so great to hear all of your perspectives on this and like the things that you remember and the takeaways that you had from that, things that stuck with you. Jessica in the chat, she shared something that I think is a little bit related to this topic, not directly this question, but I wondered if you all might want to speak to this. She said somebody at the NARTEC conference, which is a conference that happens in the spring, talked about dignity of risk and how many folks with IDD are not given the chance to make decisions that involve risk. Do any of you want to speak to that in the context of this project?
Christina, you want to?
Mm-hmm.
I didn't. You know, like you might be thinking about what you wanted to say, so I didn't know if you wanted.
I'm just trying to. I'll give it. Corey, do you have an input first? I'm trying to get my thoughts together.
Well, I mean, I can speak of Cord. So dignity of risk is basically where you allow a person with a disability, to make a decision, even if you know it's not going to be the best decision. You have to allow them to take that chance and make that decision. Just because they have a disability, they're just like anybody else that doesn't have a disability. They're going to make decisions. They're not all going to be good. They're not all going to be bad. So that's where dignity of risk comes from. So whatever they're wanting to do, it may be a risk for them, but it's not for me or you or anybody else to tell them, no, you can't do that. So I understand what she's talking about, persons with IDD. A lot of people, they think they're doing good for them by making decisions for them, and they're really not. They're not giving them a chance to be their own person and make their own decision.
Mm-hmm. Yeah, thank you for that, for summing that up for us. And that seems like it ties in really well with the Belmont principle of respect for persons.
Yeah.
Did any of you, when you were doing this, so Cora was doing the one-on-one health coaching model of this project, and then Lisa and Christina were doing the peer group workshop model of this project using the same Living Well in the community curriculum. Did any of you work with anybody who, as part of their goal or part of what they were working on during this past year, did this come up, this dignity of risk, where you were like, maybe that isn't the best thing for them, but like, I'm going to respect them and let them take that path?
I'm trying to think.
I mean, some of it was just some of it was harder. They had a goal, they had a plan, and it's just kind of giving them that buy-in, giving them the opportunity to fail. Like it's like, we could give them the information and have it all there. And I don't know where I'm trying to go with that, but it's just
we kind of let them, they had a plan. That was part of the class there. They create the goal, they create the steps to reach the goal. We check in every week to see where the progress is. And we made sure they understood that whatever choice they made to get to that next step of the goal, if it didn't work out, it was no problem. We refer to them as speed bumps, roadblocks, and what was the other one? Detours?
Detours.
Yep.
Yeah. So we kind of explained that to them. Make the choice. If it doesn't work for you, if it wasn't a good decision, one of the persons in our class wanted to make some decisions, and I know her personally, and I wasn't sure if she was going in the right direction, but it's her story to tell. So I let her go whatever route she wanted to go. So ultimately, you got to let them make their own decision, and then if that's not the right choice for them, they'll circle back, and hopefully Christina and I were able to give them tools to know how to deal with setbacks.
And I think in a way, like between the Ethics for All and the Living Well, I mean, the way it's designed as a dignity of risk. I mean, because you give them the tools to implement the thing, but it's ultimately, no matter what, it's their choice to do whatever it is. And with the ethics class, like you have the tools, you have the information, and you're like, hey, you're a part of something bigger, and you're able to, if we fail, we all fail at something, and it's just, what do we do with that? And it's just with us, we were able to help them and keep going forward, and not help them hopefully not dwell if they had a detour or a roadblock.
Yeah, that's great. Thanks for speaking to that, Christina.
I was going to say, when I first started out with several of my participants, they would have a goal and then an outcome that they wanted. And with 3 cases, definitely, I got kind of nervous because I thought you're going to fail. Like
Mhm.
cutting out dessert once a week is not going to make you lose 15 pounds in 4 weeks, but
Mhm.
we'll go with it. And because I felt that my trust in them and their capacity to make the decision and their knowledge also that it was confidential. This was just a conversation between us and they were the decision maker. It empowered them to really listen to all of the discussion built into the community or the living well in the community curriculum about setbacks and detours. And
Mhm.
none of them were as fixated on the desired outcome at the end of the project as I had feared at the beginning. So when they first set their goal, I had been like, "God, you better not. You're going to feel like a failure." And it didn't happen because I trusted them. I felt like they all trusted themselves. And so they had the dignity of risk and they had a lot more grace than I had feared initially before I really started getting to know them.
That's a great example of dignity of risk too, Cora, of like just letting people like you can help them shape the goal and you can put your input, but ultimately it's up to them what goal they want to set and trusting that they can choose that, giving them that respect.
Yep.
Yeah. Um, that's great. Do any of you have anything to add before we move into the wrap up and then the Q&A? Okay.
I'm good.
Okay, great. I'm gonna pass the next slide on to Will then.
Oh, could I just say one thing?
Mhm.
I noticed a question in the chat about balancing the values of researchers versus those with lived experience. And I felt in my role, I felt enabled to emphasize that we valued lived experience to the participants enough to give them the confidence to speak to their lived experience and to not be intimidated by these researchers that they had never met. I felt that the curriculum allowed us to give them confidence to speak up, like their opinion would be mattered.
Like it was kind of baked in a way.
Mhm. Yeah,
Yeah.
yeah.
Yeah, I noticed that com or that question in the comments too. Thanks, Cora, for bringing that
I
out.
think
I think it's a really interesting question, and I think there's different levels, like the interaction between like Will and I as part of the research team, and you all as part of the SOL staff team, like that dynamic. And then there's also the participants who were participating consumers from your SILs, and yeah, I think that's I mean, it's a whole question. Like, how do you feel like that went? Like the ideal of community-based participatory research is that we are equal partners. You all as SIL staff and us. Oh, we have a little audio interference. But I know that doesn't always like that can be complicated, even though that's the ideal. It doesn't always work out that way. So I am curious how you all felt about, was it, did you feel like equals in the partnership? Did you feel like there was more room
I
where
think
you
that
would
goes
have
back to
liked?
I think that goes back to what Lisa said at the very beginning. The communication that we had between all of us was fundamental to it all. I mean, we had the weekly check-ins, and so, or if we didn't miss a week, we had it the next week. Like the constant communication between the SILs and the research team, and then we were able to provide the feedback from the participants in real time, and then plus they had their surveys throughout the time too. So I think that was the biggest point of it. The communication between all of us, I feel like made it even no matter what, because you were giving us feedback, we were giving you feedback, you were listening to us and valuing what we were saying, and we were doing the same. And so I think that was where the whole team worked together. Y'all had your team, we had our team, but we were an entire team together.
Yeah, that's great to hear. Thanks for sharing about that. I think I'm going to move it on to Will, and then we can come back to any of these questions if folks want to, ask more about them in the last 10 or 15 minutes of our time here together.
Awesome. Thank you, Chris. So I'll just go over the quick kind of key takeaways. And I know we've been talking about a lot of this, so it's just kind of summarizing everything we have been talking about. The first one being that early engagement, at least in our experience, built a lot of trust and capacity. And that kind of goes between us as the research team with the SIL staff and the Centers for Independent Living we were working with, and then the Center for Independent Living staff and the consumers that they were working with. And tailoring the training helped that. And it also bridged the gap between the IRB requirements that we had to meet and the community needs. And like Christina said, we met weekly. And I think that was a big part of it too, was we did the ethics training once, but it kind of felt like it was ongoing because each week we would meet and we would talk about what those sessions were like and if there were any challenges with confidentiality or any other thing that kind of popped up during the trainings. And then accessibility isn't optional. It's foundational for ethical research, not only for the disability community, but for every community. So that was a huge one. And then again, the mutual learning. I feel like I learned a ton from the SIL staff, and I think they learned from us. And it was this kind of really amazing partnership between the different teams. And this was actually my first full research project at RTC Rural, and I really felt that as a researcher. And then looking ahead, and Chris, feel free to jump in if you have any thoughts on this too. We will continue this work and continue using research ethics for all in all of our research projects. The one that we're talking about is just one of our many research projects that we work with community partners, and this will be incorporated into all of them. On top of that, though, we also want to work on any feedback from SIL staff. We got a little bit of feedback, like Chris mentioned, about confidentiality and explaining that as like a SIL versus a researcher, which is something that we'll incorporate. And then I also wanted to bring up that there was another SIL staff member who is a licensed therapist, and he talked about kind of his role as a therapist versus his role as a researcher. And I think that that's something that we're thinking about too, is maybe asking questions about SIL staff's existing experience a bit more than we did in this first round of the Research Ethics for All training, so that we can incorporate those experiences and those the work experiences into the research, as well as those lived experiences.
Awesome. Thanks, Will. And that brings us to the question and answer part of the session.
Excellent. Thank you so much, Chris and team. This was really informative, and I encourage you to check out the chat. A lot of kudos in there. So a few questions that I have, and Will, you had touched upon this at your end slide of applying this approach to future projects. In addition to confidentiality and sort of the duality of the positions that people hold on the team, what are other opportunities or challenges you anticipate when applying this to future projects? And this is not just to Will, it's to the entire team.
I could, Will, do you want to go ahead?
If you want to, I have some stuff to add. I don't know if it's a fully formed thought though, so you go first, and then I'll add anything that I might have.
Sure. So one of the opportunities that we are foreseeing in even future years of the current project, but future projects for sure, is maybe doing a learner needs assessment at the beginning, which would it would hit on some of the things that Will was talking about, like helping us to understand the current level of understanding or training that various trainees already have coming in. Another opportunity would be to do an assessment of the Research Ethics for All training, or our adaptation of it, more immediately after the training. The way we did it was after, like, several months after the whole training, which of which this was one part, was rolled out. So I think we could better assess the satisfaction and any learning needs or existing questions if we did that more quickly after future trainings.
And then I was going to add, I just thought of this. It's kind of answering that question, but maybe also looking more broadly, not just to our team, but like any research team, is we have been in talks with the Research Ethics for All team about maybe doing some sort of publication about our experience working with SIL staff and that adaptation process, because the Research Ethics for All team is hoping to continue to expand this program, not just for people with developmental disabilities. So yeah, that would probably be a next step in a maybe more broad view of the training.
Thanks. So for people who are interested in applying this approach to future projects, like what is step one, right? Like how would you recommend that they get started or to start building work around it? You know, this, like, if you see this sort of as like the first foundational step, what would you recommend them to do next?
I think it depends on who their target audience is, who they're trying to reach, and what their needs are. So the Research Ethics for All training is like ready-made for community research partners with intellectual and developmental disabilities. So in our example, because SIL staff are 50% people with any types of disabilities, that was a bit too narrow. So we ended up broadening the scope, but just making sure that to have a good understanding of the learner audience to be able to tailor the training in that direction. Will, would you add to that?
Yeah, I think I'm going to go kind of like the nitty gritty of just like taking it and adapting it to what you need. There's a lot of material on the website. It's all really digestible. It's all in plain language, but there is a lot of it. So I would say, like, if you are a team who's wanting to do this and you need to adapt it to a different audience, get really familiar with the original material and make sure that you do keep those core components of it, but then think creatively about how your participants might encounter different problems in the research. Like, it was a lot of thinking about or putting myself in the shoes of a SIL staff who might be doing this research project and trying to think about the scenarios that they might have and including them. But I know I missed stuff. And so when we were talking in our research or during the Research Ethics for All, we really had a lot of conversation and tried to like just throw out any scenarios that might come up and discuss them in that moment. And then again, in those weekly meetings, continue to discuss anything that comes up. Like, it was an ongoing ethics training is really the way that I can think about it in some ways.
Mm-hmm. And I could just add a little bit that because this study was a longitudinal intervention study and we had surveys where we were collecting data at several points, we incorporated that longitudinal data collection into the research ethics training, knowing that that was something that the SIL staff were going to be encountering and that they would need to be informed about, like, oh, this is a continuing opportunity for informed consent. Like, the participant could choose to have taken the first survey but not take the second survey, and that's okay, that's their choice. So that when they were passing the information on about, oh, here's your link to fill out the online survey, they were doing it in a way that wasn't pressuring the person.
Great. And so any final thoughts, any words of wisdom as people take this and run with it for their own research projects? If you could give them, one bit of advice before they go out into the world.
I might just pop in really quick. I'm not going to lie. It was a pain in the butt when we heard from our IRB that we had to do this. It was like, oh my God, we were already rushing to get the research out and we were we kind of felt like we had to cram it in. And I was stressed, but looking back on this past year and specifically doing this Research Ethics for All, it made this research so much better. And I so appreciate that we ended up doing it because I also felt like I connected with the SIL staff a lot more. And I think that I hope from their perspectives, it's showing too that they connected with their consumers more and were able to explain this research better because of it.
Thanks, Will.
Yeah, I would just agree with that. it felt like a really strong team. And I think having this shared understanding from an early stage in the partnership was a big part of what contributed to that team building.
Great. People are commending you about your honesty, Will, in the chat. So
Thank
that's
you.
always great. Well, thank you, Chris, and the rest of the community partner research team.